Hello and welcome to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and we're delighted to have with us today two guests who are affiliated with Southeastern Health. We have Dr. Donald McKinley. He is an OB/GYN who is practicing with Southeastern Women's Healthcare. Welcome to the studio.
Thank you, Amanda.
And we have Kathy Hansen. She is the manager or program director for Southeastern Wound Healing Center here in Lumberton. Welcome, Kathy.
You too, Amanda.
So we are broadcasting live today from the Nelson & Nelson building, and we're going to start off with Dr. McKinley. And he's new to our area. He is a native of Iowa, and I'm going to let him introduce himself and tell us a little bit about his training and what brought him to Lumberton.
Thank you, Amanda. I did my residency training in Richmond, Virginia at the Medical College of Virginia after spending my undergraduate career in Iowa. And following that, I spent a number of years in Western Pennsylvania, 8 of which working for the University of Pittsburgh, and then spent the last 10 years in Southwestern Virginia.
Great.
Moved to this area for new opportunity and family.
Mm-hmm.
Having some children that are around within driving distance has been a really helpful and good for our family.
That's wonderful. Well, we're certainly glad that you decided to join us. And we want to introduce you to the community. You do obstetrics and gynecology, and you're at the Fayetteville Center right now. So tell our listeners a little bit about your practice and some of your areas of special interest.
Well, I had the pleasure of joining this health system, which I think is a gem, and looking forward to working with the people here. My partners in our group at Southeastern Women's Healthcare are all excellent people, and I've enjoyed working with the physicians as well as our nurse midwives and staff.
Mm-hmm.
As far as what I'm doing at this point, both obstetrics and gynecology, with some interest in an area that was once filled by Dr. Rozier in pelvic support surgery, and an area called urogynecology, which is evaluation of bladder incontinence issues, which unfortunately afflict many women as they age, particularly.
Mm-hmm. Okay, so tell us a little bit more about those areas.
I think there's been a lot of change in the support surgery area. Unfortunately, over time, with the history of childbearing,
Mm-hmm.
Women will lose support of all their structures,
Mm-hmm.
and to a variable degree. Many times does not require much of anything other than maybe some physical therapy and exercises.
Mm-hmm.
Sometimes can require medication, and other times even surgical support. I do know over the last 10 to 15 years there was an emphasis on vaginal mesh
Mm-hmm.
surgery, which ultimately was proven to be premature. The research had suggested that it was going to be better than the other surgeries that we were doing
Mm-hmm.
prior to that, which was using the patient's own tissue for support. In fact, there sprung up many complications that were unanticipated, and the vaginal mesh surgery now has kind of been put on hold, where the research is now being done in major centers to ensure that there's a quality product that can be used more in the general public
Mm-hmm.
than currently. So right now we're back to revision of basic surgeries that have been done in the past with much better success rates, just because of the techniques involved now, so that we can help those women really enjoy the rest of their lives. There's
Mm-hmm.
way too many women that don't take advantage of what's available these
Mm-hmm.
days, and if you will, can suffer from incontinence or the discomfort of having pelvic support loss. And those things can be corrected with education,
Mm-hmm.
physical therapy, and sometimes surgery.
Okay, very interesting. If you're just tuning in, we're talking with Dr. Donald McKinley. He is an OB/GYN with Southeastern Women's Healthcare. And a little bit later in the program, we're going to be talking with Kathy Hansen about Wound Care Awareness Month. So, Dr. McKinley, what are some of the trends that you're seeing now in OB/GYN care? Is there a new breakthrough birth control, or are there new studies that are finding that something about birth control we thought has changed that seems to be ongoing is what we thought maybe was one thing is like you said with the mesh, you think something's good for a while and then that changes. So what are some of the trends that you're seeing now that are impacting your practice?
Well, as far as contraception, probably the biggest thing that's happened in the last 10 years has been the availability of long-acting contraceptives. And when I say that, what I'm really discussing are the progesterone shots that are given every 3 months, or the under-the-skin implant that can be put on the inside part of the upper arm that are good for 3 years at a time. The IUD, which is the intrauterine device, of which now there are 4 or 5 on the market, some for 3 years, some for 5, some for 10. Some have some hormone in them, and others do not, and can be used for variable other conditions. In particular, women as they get into their 30s and 40s sometimes have heavy bleeding issues, and the IUD with a little progesterone in it can be very helpful for those women, avoid surgery, and bring them from where they are to the menopause without really having to do much more. The impact has been, for the first time since I have been practicing, we started to see a decrease in the teen pregnancy rates. I think a significant part of that is attributable to the long-acting birth control that can be available now. The FDA just approved within the last few years the use of an IUD in non-pregnant teenagers, or teenagers that have not been pregnant before. And those have all really spun off and have become accepted. The health departments are using them more routinely now, and I think that's had an impact on teenage pregnancy rates.
Interesting. What's the marker for when a young lady needs to go see a gynecologist for the first time? Is it when she begins her menstrual cycle, or what's the recommendation for when a woman needs to start having those conversations with her doctor?
A couple things to preface that. I think that either with a pediatrician or their family doctor, there's available now a vaccine for cervical cancer prevention. It's human papillomavirus, which is ubiquitous in our population. Has certain strains that can really predispose to cervical precancers and cancers down the road. A vaccination program in teenagers, both male and female, by the way, can be instituted generally around 12 to 13 years of age, and that is something I would encourage all parents to consider with their children, because it substantially reduces the risk of cervical cancer by as much as 70%. And other associated diseases such as genital warts by 90%. So that is an opportunity. As far as a gynecologist evaluation goes, if they're having difficulty with their menstrual history, then that's certainly an issue and can be addressed both with their primary care physician as well as a gynecologist if the general evaluation is not supportive of a easy treatment plan. Certainly onset of sexual activity is something that does require some counseling and education for these young women and men. And I think that the other thing that has changed in our area through very good research at this point, which is now becoming more and more accepted, is the fact that there is a difference between how often to come for a GYN exam and how often to actually have a Pap test during that examination. Currently, the recommendations are now starting Pap tests at age 21, but that doesn't mean you start your exams necessarily at age 21. As you also well know, the mammography and breast cancer screening, we have different societies within the United States recommending different variations on the same theme. And the American College of Obstetrics and Gynecology does recommend that women at age 40 and above talk with their physician regarding what's appropriate for mammography screening. Some of that certainly can be based on family history of breast cancer or other predisposing risk factors. And I think that those kinds of issues are important. So the examination, how often to have the examination, is really between the physician and the patient, and dependent on the risk factors involved and what's happening in that patient's life.
And I would like to remind our listeners that Gibson Cancer Center has the navigation program with Cat Gaines, and they have the BCCC program that's helping find resources to pay for mammograms and different kind of screenings. So if our listeners would like to look up Gibson Cancer or go to southeasternhealth.org and look for that information, there are resources there to help with some of those screenings that are very important. So gynecologists, you can go with people through that time when we just talked about, through menopause, I guess, and beyond. So you're sort of with women for that role, could be long term.
Absolutely,
Yeah.
and it's not one size fits all,
Yeah.
and not even one. Even patients within the same age group may have different needs and require different approaches to their medical care. Certainly in my field, there's occasional need to see a child. But most of that is impacted as the patients get into their menstrual lives and then their sex lives and move on to being independent adults, to being adults with families, to being adults whose family are grown up and leaving the house, to eventually the aging process, the menopause, which can be associated with spousal loss at times, and how to address the needs of women in general when they are facing those kinds of problems and decisions.
Interesting. And so as an obstetrician, though, you're there for a specific reason and hopefully a happy time, but then there are many challenges that come along with that. So talk about when you put on your obstetrician hat, sort of how that role is with your patients.
That's an exciting part of
Yeah.
our practice, and I always look forward to that. Certainly, a vast majority of the times we're talking about a happy birthday party at the end of the process.
Right.
But certainly there's a big need for education, and the impact these days certainly can be made with prenatal care and preconceptional care prior to getting pregnant, to address any chronic disease issues a patient may have, such as diabetes or hypertension, to address a proper nutrition and diet, particularly rich in folic acid, whether that requires supplementation with things other than food. That depends on the patient. And to be able to give them the tools to really help them reduce their risks, again, smoking, other drug use, certainly are risk factors that we see with patients walking through the door for their first prenatal visit.
Yeah.
So certainly identification of risk factors early, prior to conception, would be the ideal and always recommended. Once we see them in the office, identifying those factors, reducing what we need to as best we can, and providing the support for a healthy pregnancy.
Absolutely. Through the birth.
Through the birth.
Great. And you would deliver at Southeastern Regional Medical Center?
We do.
The babies,
yes.
Yep, it's on staff there. So what are some challenges that women face? I know you haven't been here long, so you're still acclimating yourself to this community and this patient base, but through your career, are there certain things that seem to be more of a challenge for women, or is it pretty much just all over the place? Women have, depending on their environment?
I think medicine in general is shifting toward a quality-based, patient-centered, family-centered approach with a team approach. And certainly there are common themes, no matter where you are in the United States, that impact women's health care, and access being one. I think that it's important for people to understand what their health care is, take some ownership, and to do those things that make sense in their lives, and get the checkups when necessary. I think education is probably the biggest nut that we've had to crack with people regarding what is available. There's a lot of things that can be available, both from the healthcare provider as well as the community. This community has been very progressive, and I think provides a complement of healthcare choices for patients that they could take advantage of, but it's a matter of knowing where, when, and how to be able to do that. So I think education regarding my corner of the world, their gynecology health as well as obstetrical risks, and alleviating those the best that they can. Those are really important things. Inclusion these days is important because not everyone is the same. We all have different backgrounds. Being respectful of the patient's life, what their choices have been, and trying to center your care based on who those people actually are, not who you think they are.
Right. So today we're talking with Dr. Donald McKinley. He is an OBGYN affiliated with Southeastern Women's Healthcare and Southeastern Regional Medical Center, and he's new to the area, so we wanted to introduce him to our community. If you have questions about any of the information he's presented or would like to call Southeastern Women's Healthcare, which is located at 4300 Fayetteville Road in Lumberton, you can call 910-608-3078. And again, that's Dr. Donald McKinley. Is there anything you'd like to add about your time here so far, or the community in general? Or
I think the exceptional thing about this community has been how nice the people have been. I think they should take great pride, because I've been many places in this country, and no place has had warmer and more engaging and respectful people than the Lumberton area. It's a special thing, and I think that the people in Robeson County deserve the best health care. I think Southeastern Health System can help provide that, and I think they're well on the track to being able to do that.
That's wonderful. Well, thank you. We may hear from you a little more as we continue, but we're going to transition with Miss Kathy Hansen. She is the manager of Southeastern Wound Healing Center. If you read the Robesonian, you find that she has a fitness column in there about every other week, as she was a trainer.
I was an athletic trainer in my previous life
with Southeastern Health, and so she transitioned to a physician liaison and now as program manager with our wound healing program. And so June is wrapping up, but it is still Wound Care Awareness Week. So Kathy, tell us a little bit about what Wound Care Awareness Month is.
Okay, thanks, Amanda. And Dr. McKinley, that was all good stuff. And as somebody who has lived in this community and moved here 30 years ago, I have to agree. And I stayed because the way the community is. It is a wonderful place to live and raise your kids. So welcome. I'm glad you're here. Wound Care Awareness Month is really a project of my company, Healogics, which is a company located in Jacksonville, Florida. And we partner with hospitals across the country to bring specialized wound care. And we are very fortunate to have a partnership with Southeastern Health, and it's been a great partnership for the last 5 years. So Wound Care Awareness Month is an opportunity for us as program directors to get out into the community, to meet with physicians and meet with community members, to let them know what our facilities like and what kind of offerings we have here in the community, and also to bring awareness, obviously, to the fact that chronic wounds are a problem in the United States. Right now, there are almost 6.7 million Americans who suffer with chronic wounds. And a lot of those people are not getting help, either because they don't have access to it, or they don't know that they have access to it, or a lot of times they're ashamed of having that wound and they're not quite sure what to do. So we're trying to make sure that people know that we're here, that we can help, and we can heal them. So that's kind of why Wound Care Awareness Month has rolled out. So I have spent many an hour on the road driving to doctors' offices. I visited probably 103 doctors' offices and clinics over this past month, shouting the word of wound care and what we can do to help their patients, and hopefully they'll be able to get the word out to their patients as well. So that's kind of what we're doing right now.
And I know you have your ad on the city bus, the Seats bus.
We do.
We see that around town.
We do. We have an ad on the Seats bus, and a lot of times it transports patients to us, which is fantastic that the community has that. So I do see our bus pulling up sometimes and dropping patients off. And we've got a brand new banner on our building, too, to kind of let people know that we're here and we're available in the community.
Transportation can be a huge issue getting to those appointments.
Absolutely. And we are really happy to have Seats and some of the other transportation options that we have for our patients. It's been a great help to them.
So describe briefly what services you offer, HBO, chambers, and the like.
Wound care kind of is a two-part animal. First and foremost, for wound care, weekly visits are very, very important. Wounds heal in a way that is not very complicated. It's a pretty simple procedure. If any of us walked out of here today and skinned our knee in the sidewalk, our body would say, uh-oh, I have a wound. It needs to heal. It would send signals and send the kind of materials that need to heal it. For somebody who has a chronic wound or has health problems that can't heal, that doesn't happen. So what happens in a wound center every week when the patient comes is the doctor will do debridement, which basically is they go in there and kind of, what I say, stir it up a little bit. Use a curette, which is kind of a sharp implement. No pain, I promise. I've never heard anybody scream, and I'm in the office a lot, to debride away that dead tissue to fool that wound into thinking that it's a fresh injury, so it starts to heal itself. That's some of the things that we do on the wound care side. We also use specialized wound skin substitutes to provide those materials that might not be there naturally in that person's body. So those are the things we do on the wound care side. Hyperbaric oxygen therapy is specialized treatment that's used for particular injuries and particular problems. It was discovered back in the 70s, actually, was used for people who suffered from injuries, from diving injuries, who came up too fast in the ocean and got sickness from that, diving sickness, the bends, what happens with hyperbaric oxygen, basically, that oxygen is pumped in at 100% oxygen, is pumped in under pressure, kind of like if you were to go underneath the water in your swimming pool and you feel your ears pop. Once it's pumped in under pressure, it causes new blood vessels to grow. When those new blood vessels grow, it increases circulation and it can enhance healing. So that's another option of a way that we can heal patients. So that's kind of a really cool technology to have.
And you have multiple chambers, correct?
We do. We have two chambers in the facility, so we can treat up to 6 patients a day. Most patients are there for at least 30 treatments for most diagnoses. And they're there for an hour and a half to 2 hours by the time they get in, get out, and get changed and back to the lobby 5 days a week. So it's a big time commitment.
Yeah.
But I've seen patients come in there who are facing limb loss, who've been able to walk out and keep their limb, and they'll cry and they'll hug you, and it's just a really, really heartwarming thing to be able to change somebody's life that way. So it's really a cool place to work, I think.
Yeah. Well, that's great. So before I talk about access, I know you have a foot care awareness month and diabetes awareness month. So is diabetes the number one disease or cause in the neuropathy, or is it just across the board? What do you see typically with your patient base?
Typically, most of our patients are diabetics. Diabetes causes healing not to occur, number one. Number two, what you talked about, the diabetic neuropathies. Most diabetics, if they don't have their A1Cs under control and don't keep their blood sugars under control, can end up with not being able to feel their feet. So they can receive an injury, don't know they have it. Whereas the three of us, I'm so excited. I'm counting down the days. I'm going to the beach next week for my holiday. And I know when I walk on the beach and that sand's hot, I'm going to put my flip-flops on or I'm going to run.
Right.
Someone who's diabetic can't feel that, may step on the hot pavement, may step on a seashell, have no idea that they've cut their foot. That becomes infected, that doesn't heal, and that person ends up with a chronic wound or a wound that won't heal. So diabetes, and as you know, and I know you've had guests here to talk about that from our wellness side, diabetes is huge in our community, and so we see a lot of diabetic patients, a lot of people who have peripheral vascular disease, or if your doctor tells you have PAD, poor circulation, that can cause it. Sometimes people who've had cancer treatments or radiation treatments can end up with chronic wounds. So those are the top things that cause it.
Well, while we're talking about diabetes, and because that is such a large issue for this community, I did want to mention we do have diabetes educators that are affiliated with Southeastern Health, and so if some of our listeners are listening to this and they have it and they're having trouble managing their disease, they can ask their doctor for a referral and they can meet with these educators. And that number is 910-618-0655, and they're trained, credentialed diabetes educators who can help try to prevent getting to the point where they're going to need your services. But it's absolutely wonderful that it's here for those who need it.
Exactly. To prevent it, or if they do have a wound and at least they're keeping their blood sugars where they need to be, they will heal up much faster and they will get much more benefit out of the hyperbaric if they're in the hyperbaric chamber, if they're keeping their blood sugars under control. So,
and they can even work with people who have gestational diabetes too. So that's a great resource for the community to help anyone who's dealing with any kind of pre-diabetes, diabetes, gestational, a resource in the community to help with that education part, because sometimes that can be a challenge. So how can patients access your services? I know for some there's a referral requirement, for others there isn't.
Yeah, what's kind of unique about our clinic, with it being a specialty clinic, is that there are 2 ways to get in. You can get referred by your physician, or you can refer yourself. All you have to have is a wound that hasn't healed in a normal amount of time. If you've got a chronic wound that's not healed within 3 to 4 weeks and you still have it, pick up the phone, you call, you're going to get Amanda on the phone. She's crazy, but she's wonderful when she answers the phone. Not this Amanda, a different Amanda. Call and get Amanda. She'll answer the phone and she'll get you right in, and we can see you right within a week. We're very, very, very quickly can get our patients in. We can see Medicare, Medicaid, all private insurances, so nothing should be a barrier to getting your treatment. And it's just so important because those things can lead to so much more problems, end up in the hospital with systemic infections, things that are life-threatening. So don't ever let a chronic wound like that go, because they can go south very, very quickly, and we can prevent that for you.
And no one wants to lose a limb that
Absolutely.
could have been prevented, because that's your quality of life. And
right, and the mortality rate for people who lose limbs, it's almost double the chance for you to die once you've had something amputated. So you don't want to ever lose, don't say, well, it's just my toe, because normally it's just that toe, and then it's the next one, and then it's your half of your foot, and we don't want anybody to have to do that, and we can keep that from happening if you just give us a shot.
And talk about your panel of physicians and your medical director, because it's important for our listeners to know what resources you have there as far as physicians.
Sure. Our main physician, our medical director, is Dr. Carl Moo Young. Some of you might have known him. He was a Southeastern health physician at one time, worked in Grays Creek Clinic and also at St. Paul's. He is a heologic specialty physician. He's the medical director. We have some specialty panel physicians. Dr. Okoye, who is the infectious disease doctor, works on Mondays, so he takes care of some of the more odd things that we see that come through the center. Dr. Matthew Thompson is our podiatrist, so he sees a lot of the diabetic foot ulcers. Dr. James McLeod is a panel physician with us also. And then Dr. Joe Roberts, who is also the hospitalist director at the hospital, is still on our panel, and he's our go-to backup guy. We hated to give him up, but he's a valuable part of the Southeastern Health Administration team now. Right. But he's also a backup for our physician panel. So we've got a lot of different specialties and a lot of different options, and we're open 5 days a week, all day long. So you should be able to get in and see any one of those fellas, and they do a fantastic job.
And if you would share your phone number for our listeners in case someone's heard our show today, hopefully, and decided they may want to seek your services.
Sure. If you need an appointment with us, our number is 910-738-3836. And we're located right across the street from the hospital at 103 West 27th Street.
Okay, great. And that's Kathy Hansen. She is the manager of Southeastern Wound Healing Center, and June is Wound Care Awareness Month. Thank you for sharing that information.
You're welcome.
Our guest earlier in the show was Dr. Donald McKinley. He is with Southeastern Women's Healthcare, OBGYN, and that clinic is located at 4300 Fayetteville Road. And if you'd like to schedule an appointment or learn more about any of the information he shared today, that number is 910-608-3078. Is there anything that I haven't touched on that you wanted to get in today? Any information to share?
Well, I'm excited about the future of women's health care in this area. I think this is a special time when maybe we could start to develop and trend toward more comprehensive women's health care that's able to address not only their specific gynecologic needs, but their psychiatric needs. And as we know, there's a cardiology and how women respond to cardiac illness is different than with men. We have here at Southeastern affiliation with Duke, and certainly to dovetail that into that program would be wonderful. And I think that we've got some very good people here that I've met, and in my specialty particularly, the availability of robotic surgery is here, and we have multiple modalities for minimal invasive surgery for outpatient as well as just an overnight stay. So a lot of good things happening that I think we have the ability to dovetail and continue.
Great. Well, thank you both for being here today. This is Southeastern Health's Healthy Connection. We're here at WAGR 1340 AM on the fourth Wednesday of each month at noon. And we'd like to thank Mr. Wesley Johnson for running the board for us today. And we're always glad that we can be here and share information with the community. If you'd like more information on any of the services or programs you've heard, you can check us out on the web at southeasternhealth.org, or you can look us up at Southeastern Health on Facebook. Thank you for joining us for Southeastern Health's Healthy Connection.